Hi, Assalamualaikum. My name is Putri Ifa Irdina binti Izra Shahril. I'm from the Bachelor of Medical Imaging Cohort 12A from KPJ Healthcare University College. So today I'm going to present to you about forensic radiography, specifically skeletal survey, which is a common radiographic findings in non-accidental injuries. For today, we're going to look into six content. The first is just we're going to look into the introduction to the forensic radiography, introduction to the non-accidental injury, and then we're going to move into the case study of a long bone fractures, shaft and metaphysis, and then rib fractures, posterior and lateral, vertebral body, which is compression fractures, and lastly, we're going to look into skull fractures. The first is introduction to forensic radiography. So what is a forensic radiography? Forensic medicine refers to the application of the medical knowledge in the collection of medical evidence that can be used in the court of law. So which such evidence that can be collected from either living or a deceased subject, with the latter presented as either a whole cadavers or just a pathological supplement. So that's evidence that can be used in the question of law. So the forensic radiography is just an application of the sign of the diagnostic imaging that can be used to question in the law, in the court of law. So, what is a non-accidental injury? Non-accidental injury, which is any bodily injury that is deliberately inflicted on a vulnerable person that is considered unacceptable in a given culture of a given time. So, non-accidental injury can include hitting, kicking, burning, biting, or choking. So investigation on these non-accidental injuries require a thorough history of a clinical examination that can be supplemented by the radiological investigation, including the radiographic and the cross-sectional imaging. So as you can see from this picture, there's an abuse and accident. So for the non-accidental injury, it covers the abuse part of a child body. Some example of the non-accidental injury is that we have soft tissue injuries that commonly bruises, abrasion, or bite marks. We have fractures that we're going to look into one by one. We have skull, spinal burns, which is different accidental burn and abuse burn. Abuse burn is a well demonstrated second or third degree burns. And then we have posterior ribs, neurological injuries, abdominal and genital injuries. The first case study, we're going to be look into the shaft, spiral mid-shaft right femoral fracture. So we can see from this radiograph, we have frontal and lateral view. This is from a 6-week female that were brought into the hospital by her mother after her mother noticed that is inadvertent forceful twisting of the thigh when the mother was changing her diaper. So why is it called a spiral fracture? This is because the broken bone resembles a corkscrew or a winding staircase because the break happens diagonally across a bone that is longer than its wide. So, however, the radiographic skeletal survey reveals there is no other injury was seen. However, when the bone scan was performed, there's a increased uptake in the right fourth to the seventh posterior ribs. Ribs posteriorly consistent with fractures. So this is a common site for the non-accidental rib fracture in infants because there is due to a compressive squeezing force that was applied to the chest. Second cases is the metaphyseal corner fractures, or we can call it a bucket handle fracture. So we can see this radiography. We have a frontal and lateral magnified view. This is from a 1 to 2 years old male toddler that were brought into the ED because based on the radiograph, we can see there's a subtle fractures of the anterior aspect of the distal left tibia here. So metaphyseal fractures are also known as the bucket handle fracture because this is referred to the injury of the metaphysis, which is a growing plate at the each end of a long bone. As you can see from this figure, the metaphysis, and there's a fracture. This kind of cases can happen when the child or infant were handled with a forceful handling. So it can make the metaphysis to be fractured. The third cases, we're going to look into the ribs fracture, which are posterior and lateral. However, I was only able to find the frontal view, and this is from an infant with an unknown gender. The background of the cases is that the infant fell off the couch and hit its head and had a seizure. So the analysis found that multiple fractures can be seen involving the posterior ribs bilaterally, and the infant is intubated. So posterior rib fractures are the most common result of the anterior posterior compressive force. But if it's in the context of an inflicted injury, the most common result was of an adult hand squeezing the chest, the child's chest. The lateral and quadrantal junction fractures can also be result of a compressive force, especially if it's a bilateral. The next case, we're going to look into the vertebral body, which is a compression fracture. This case is from a 20-month-old female infant that fell from a window, but however, the circumstance suggested that she was pushed down or just thrown out from the window. The analysis said that a subtle dispersion of the superior end plate of the T5 in keeping with fractures, and also possibly of T4 and T6, as we can see from the radiograph. There is a no rib fracture, and the patient also have concurrent parietal skull fractures. So sad news for the additional information that the child has died from this accident. We're going to look is the skull fracture. This is from an 8-week-old male infant, which is the head was impacted the corner of the shelf while being held in the father's arm. So when we see this A radiography image, that this is a selected axial slice from an unenhanced CT scan of a brain, reveals that the minimally displaced fractures on the right parietal bone with an overlying subgallal hematoma. We can see in the arrow shown. So, but there is no intracranial injury. This is for the anterolateral part. This is the lateral. The posterolateral 3D reconstruction better demonstrate that the extent of the fracture. So the fracture extends from the superior sagittal suture to the right lambdoid suture. So that is all from me today. I hope from all the slides given, we all learn and about new additional information or general knowledge on the forensic radiography. Thank you for listening.